So you've been a practicing dentist for over 10 years now. What would you say would have been one of the most important things you wish you would have known at the start of your career?
Understanding my mental health. In the beginning, you start practicing dentistry and it feels like everything's brand new. And that sense of newness is what's going to go ahead and push you through. But the problem is that newness tends to go away, especially as you start to see the same procedures, patients, and that is going to lead to burnout. And a lot of people don't even realize that they're in that spiral. I never realized I was even burnt out until the goals that I set for myself were just non-existent.
So looking back now, what would you say were some of your red flags?
I would go ahead and say that how it affected my relationships, the relationships I had also with my staff. You go ahead and see that every kind of relationship, even with family, suffered. Because as you get burnt out, you just have less of an ability to care.
Yeah. We obviously know now that you wish you would have known how important taking care of your own mental health was at the start of your career. But how do you see that translate into the lives of the patients that you were treating?
If you don't have control of your own mental health, then it's almost impossible to give real treatment to the patients, especially even if it's just managing the patients. It's a skill. How can you teach a skill to a patient if you don't have that skill yourself?
Of course not.
So it obviously starts with yourself. And then once you have that ability to learn how to do it on your own self, then you're able to have just remarkable changes with your patients. Before I understood these concepts, I felt like I was really just patching up than anything else. I was never actually helping somebody. And
what do you mean by that?
I would get a patient, they would have all these problems, I'd fix these problems, and then they would come back with the same problems.
So like recurrent caries.
Where you really see this a lot, periodontal disease. With periodontal disease, how many times does a patient come in and either they don't want to do the treatment, to now they fix the problem, but then they just come back with more periodontal disease. It's very unlikely that if you don't understand mental health, that the patient themselves is going to have the tools to go ahead and do it. When I think of all the patients that did it sporadically, it's far and few between. Whereas now, it's batting 100. And
what do you mean by that?
As in, I'm able to go ahead and actually help them with their mental health to realize what's lacking in their life so that we can actually make meaningful changes. A lot of it has to do with the person not having the compassion for themselves, the love for themselves. They don't have that self-worth to say, I'm going to dedicate this time and do it on myself.
Yeah, like brush my teeth, the right amount of time, follow the dentist's recommendation, make my appointments, show up, the whole thing. And the thing is like, you're absolutely right. Like when we don't really value something, we don't invest our time in it. We come up with excuses. And when it translates to your health, if you're canceling appointments, if you're not taking the time off of work to go ahead and do something that is only going to get worse if you don't do it now, right? What is the root cause of that behavior of not making the appointment, not following through, not taking care of yourself at home, whether it's from brushing your teeth to eating healthy to exercise to whatever, right? There is some level that you do not believe that you're worth it. Because if you did, you would invest the time.
Yeah. I'd have some patients actually just flat out say that.
Yeah.
I don't think I'm worth taking care of myself. Can you remove all my teeth? I specifically remember this one patient that said it crystal clear just like that, and there was nothing wrong with his teeth, and he wanted them all yanked out. But again, it happens more often than not that that's the case. It doesn't necessarily have to be I want all my teeth yanked out, but maybe it's just one tooth, or maybe it's just I don't want to do my deep cleaning, or maybe it's I don't want to go ahead and fix this.
Well, I mean, I could think of this, wouldn't this be the perfect definition of recurrent caries? That maybe, of course, sometimes the previous work that was done creates an issue where the patient can't clean the area as well. But wouldn't you say that in a lot of the other cases, it's just that their brushing habits have not improved, so they're getting decay in the same location as before?
Yeah, absolutely.
It's true. So obviously you're not burnt out now.
No.
And so what would you say has been the biggest tool that you have found now that you use on a daily basis to support your mental health?
Internal family systems. And once I started to understand internal family systems, and this is the thing, you can understand internal family systems from a intellectual level, and that's not what I mean. I could teach you internal family systems in 5 minutes, and it's not going to be as life-changing as it should be. In fact, if you think you understand internal family systems and you don't feel your life changed, you don't understand internal family systems. Okay. So internal family systems is what I use in my daily life, and I especially use it in my practice.